I have actually three objectives with this presentation. The first one is why it is important, this model disability survey for WHO, from WHO perspective, where we are coming from in terms of disability data, and where the WHO, the World Health Organization, is coming from in terms of disability data. And the third one is where we are with the implementation of the model disability survey. And as many of you probably know, so WHO has been interested on collecting data on disability for a long time. So we could even go back to data collected in the last century on disability. It was really in the early 2000s with the implementation of the World Health Survey in 70 countries when WHO collected systematically data on disability and comparable data on disability around the world. It was also this data collected in 70 countries, the data that WHO used to put forward the disability estimates of 15% of the world population experienced significant disability in 2011. And we knew, and at that point, when we put forward the report, and actually based on the analysis that we did at that point, disaggregating data by disabilities, that there is huge differences between people experiencing high levels of disability with the rest of the population. So we already disaggregated all this data at that point in time and reported about it in the World Report on Disability. We knew also already at that point that actually we are only telling one part of the story of disability. And the story that we were, and actually the story that I also wanted to say is that WHO, what is interesting, that we are already planning the second wave of the World Health Survey, what will also provide some comparability from the data that we collected in 2002, 2003, and then when we implement probably in 2020 the second wave. We knew that, as I said, when we implemented the World Health Survey, also with the production of the report, that we were only talking partly really the story on disability. And the reason for that is because we concentrated indeed as in disability understood exclusively as the consequences of health condition impairments. So we always consider disability as a continuum in which anyone in the population can be experiencing from low levels of disability to extreme levels of disabilities, and where you are would depend from the health condition you have. In some cases, you will, for example, if you have a severe substance use disorder, high levels of disability. In other cases, you will have very low levels of disability, and many people, depending on the severity of the health condition, will experience different levels of disability. So that was the data that was collected at that time. And to capture this concept of disability as the consequences of disease, and we could even say more from a medical perspective or the medical model perspective, we use questions that are asked like, because of your health, how much difficulty do you have in different functioning domains of your life? And in the World Health Survey, we ask self-care, we are moving around, concentrating and remembering, and in a total of 8 domains. And actually, these are the kind of questions that have been implemented for a long time in many different surveys around the world, and also the same perspective of the questions that also we can see in the Washington group questions. We know also, and WHO already knew after having collected this data, and since we presented the conceptualization of disability that we present in the International Classification of Functioning, Disability and Health, that actually disability does not only depend of your health state or the health condition, that the environment has a tremendously impact on disability, and that actually disability is the outcome of the interaction. That it may well be that two persons with exactly the same health condition and the same health state, depending on the environment and the barriers and facilitating environment in which they live, they can experience very different degrees of disability. We know also that two people with very different health states or the health conditions also can have the same experience of disability. And with this perspective in mind, it was when WHO, together with all its member states, proposed or endorsed the Disability Action Plan with one main focus on disability data. It's one of the main objectives of this action plan. And it was a commitment on collecting data on disability that we can summarize as going beyond the medical model, going beyond disaggregation, and to identify, going there where we can identify factors that contribute to the design or to the evidence-based policies. And that is really what the MDS, the Model Disability Survey, is all about. It's about collecting this comprehensive information on disability. We collect information always on the environment, on the barriers or the facilitated environment. We collect information on the health state, and we collect information on the outcome of the interaction. And actually, that is what we can say, that is the Model Disability Survey. In the brief version of the survey, we have actually 38 questions that can be implemented as a 12-minute module. And actually, this module has now been integrated, for example, in the National Health Survey in Chile, in the National Social Vulnerability Survey, also in Chile, also in Tajikistan, in the National Expenditure Survey. What we are doing when we communicate with countries and with the statistical offices, as for example, we have done a couple of months ago in Tajikistan, the expenditure survey is a household survey where the head of the household responds for the whole household. What we, in discussion with the statistical offices, has been, or will be implementing is a data collection in which in 3,000 households, an adult and a child is selected to be able to provide direct data and not only reported by the household. And this data will be collected also in yearly. Now, and some of you have heard me talking about implementation on the Gallup pool. Now, as we speak, and now it's a reality because now the data collection is indeed in the field, we are implementing this the brief NDS in Tajikistan, in Laos, and in India. And the interesting thing, of course, will be having data that will provide not only relevant information related to disability that we already collect in terms of the environment of the person and in terms of the health state, but also all the relevant information that is contained in the Gallup pool, that is about well-being, but of course it is also about food and shelter, it's about citizen engagement, it's about communication and technology that is extremely relevant for persons experiencing disability. Probably you are curious, what are the kind of questions that we ask in these modules? And I thought, okay, I will show you some example of the questions. For example, regarding to the environment, and we always start the questions or the survey with the environment. We want people to have a mindset focusing on the environment because it's a population-based survey of a representative sample. It's questions like, does the transportation you need or want to use make it easy or hard for you to use it? Do you make your own choices about your day-to-day life? Do you currently use any kind of the following assistive products? And we provide then a menu of assistive products. In terms of disability at the outcome of the interaction, the way how we ask the questions is a little bit different. And we have been playing for a long, long time, actually for 3 years, trying to get the questions that get that concept, that put the accent after having been thinking about your environment, how do you get the outcome of the interactions? Questions like, how much of a problem is getting where you want to get? It is not about you, it is about whether it is a problem for you, or how much of a problem is toileting for you. So again, it is not about your problem, it's about whether that activity is a problem for you. In terms of the health state, we start with a question in which we ask self-reported data on health conditions and also on the general health. Again, to have the mindset of the person thinking now about you, about your body. And then we're going to asking those questions that have to do with your difficulties, the difficulties you have associated to your health. And that is the reason why we make also many of the questions asking, because of your health, do you have difficulties with? So it is to get the health state. In many countries, or the many countries, want to implement a survey and a specific survey on disability to get even much more in-depth information on disability. That is the reason why in the full model disability survey, we have many more questions for each of these components, for the environment, for disability, and for the health state. Because also countries want to have that level of granularity, and even in many cases report also how many people have difficulties indeed with self-care, or how many people have difficulties concentrating, and then compare that with the number of people that have then problems as the outcome of the interaction with the environment. In addition to that, since it is a full survey dedicated to disability, you need more relevant information. That is the reason why we propose countries a module on, of course, always on socio-demographic data, but also on work, on education, on healthcare utilization, and on empowerment and well-being. And these modules, sometimes the countries even add additional one, or in some countries even reduce, or we negotiate with the countries what are the experiences with other countries, so that they really customize to the needs of the countries. The development process, we started the development process of the NDS in 2012. We had 3 years of development and testing in different countries. And then we started in 2015 the implementation in countries. So we started in 2015 with Chile and Sri Lanka. Then we have some regional surveys in some countries, like, for example, also in Pakistan, where a region is a huge, are huge. So in Pakistan of Cameroon, we have regional regional surveys, and in the Philippines, in Qatar, we have then comprehensive full surveys, and as well in other countries still, like Costa Rica, like also Tajikistan, and so on. And then we are already negotiating the next implementation for 2019. Something that it is extremely important to us, because when we talk about collecting data on disability, we put a lot of focus on the collection of the data. But it is a long journey. What we from WHO perspective, go with the countries in order to get there where we really want to get. So before we collect the data, there is a number of steps that happen that go from identifying who will be using this data, customizing or producing a protocol, customizing the data. We go into the translation of the questionnaire with the country, and we do the tabulation planning, the sample size always in collaboration. And of course, after the data collection, it is a lot of steps that need to happen until you get there where you want to get in terms of data analysis, data processing, analyzing, reporting, process evaluation, dissemination, so that you have then an implementation in policy. And that is the journey that we go then in the different countries. What we also do with countries is the discussion, to have the discussion how they can integrate the data that they collect into their monitoring system for the Sustainable Development Goals. We know that actually we have, in most of the cases, depending on the data that then is collected in the customized surveys, that at least 15 of the indicators for reporting of the SDGs are included in the Model Disability Survey. What we also know is that if we look at the data from the perspective of the monitoring of the Convention on the Rights of Persons with Disabilities, we address in the Model Disability Survey many of the articles of the Convention. We know, we are also aware, of course, that new indicators for the Convention are being planned and put forward by the High Commission on Human Rights, and then we will have to compare the data of the Model Disability Survey with those indicators once we have it. What is extremely important to us is that we talk with the countries on disability not as a binary reality. We always say we cannot say, or that we should not collect data with the perspective of identifying the disabled and comparing it with the rest. That we need to have an inclusive discussion of saying disability is a human experience and it's a continuum. And everyone in the population is in that continuum. So the question is to be answered is, what is the distribution of the population in the disability continuum? And then you set the cutoff accordingly, and you can set even different cutoffs for different purposes in order to see the differences. What is extremely important also for us, and especially from a public policy perspective, is to get to know who are the people in the middle levels of the continuum and what are the actions that are needed for this also specific population. And especially I think is to promote this conversation of having disability seen as a universal experience. Just to show you some examples where we can go from disaggregation of data. So for example, here the percentage of persons who often felt discriminated, and you see from the perspective of the continuum of disability, how the level of feeling discriminated can increase with the experience, with increasing experience of disability. We want to go beyond disaggregation, and we of course, that is done what we do with the analysis, looking at, for example, again, what is the percentage of people that have problems using transportation? What you see in, for example, in Chile, how the number really steadily increased with the disability, with the amount of disability that the person experienced. The nice thing is when you can link this information to the barriers that people experience, and policies would be completely different depending on whether you see that actually so the policies would be completely different depending on whether the level of the barriers experiencing is for the whole population or only for the population experiencing severe levels of disability. And we go even further in the analysis with the country to identify what are the barriers people experience. For example, in Cameroon, data that is being used now for advocacy in the region where we implement in the survey is what are those environmental factors that have an impact in people experiencing moderate and severe disability, where we realize, or where we found out that is indeed the physical environment and the attitudinal environment, the one that create or they have the huge impact. And you can go then further in which are the specific aspects of the environment creating those barriers. So finalizing is, from our perspective, is important to strengthen always and to have the discussion with the statistical offices and always bringing on the table for the discussion of disability data all the relevant stakeholders of that data, capturing disability comprehensively, going beyond disaggregation, and especially putting the accent at the end of the whole process on the impact from an evidence-based policy perspective. Yeah, thank you.
Thank you very much, Alarcos. That was a really interesting presentation. There's quite a lot there to take away, but two or three things I took away was just disability is the interaction between people's health and the environment, and then this point, it's not a binary thing to look at, it's actually a spectrum. So I think that was really interesting. But we've got a few minutes we would take just for any questions about what Alarcos has said before we move on to our next speaker. So anyone in the room? So we have got one question here, so go ahead, please.
Sorry, it's Matthew Powell with Office of Policy Management. I think your idea about the disability spectrum is very important and very interesting. But I think the consequences of that is that you're always trying to look at, give your questions to the general population. And so we know, because for quite a long time now, there have been some questions included in things like living standard measurement surveys. And what you tend to see is that you don't get anything because all the confidence intervals overlap. You know, when you go, if you throw in some sort of binary definition, then you can get significant differences between the disabled and not disabled. But when because you don't capture that many of the disabled in the household survey, when you try and look at disability in this survey compared with the last survey, or disability in one region compared to another region, you just get a load of overlapping confidence intervals. So do you have any methodology for actually doing a sample boost right, so that you do get people?
Yeah, and it is, I'm thankful for this question because how we analyze the data is based on rationalisis and item response theory. So that from the ordinal scale, we create the metric, a metric scale from 0 to 100. And then you can obtain very clearly differences in the sample based on the data you get. And the important thing is that you overcome the challenge of comparability data across countries, because you can also analyze the data from different countries together and put them in a single metric. And that is the advantage of using item response theory for that. And even if you have questions that are slightly different, even if you would have questions that have slightly different response options, you would be able to have this, to be able to capture to address the challenge of comparability among countries and among regions.
Just for clarity, so if I've understood it, then your methodology enables you to give every individual in the survey
Every individual.
gets a disability
Yeah,
score
exactly.
between 0 and 100.
Exactly.
So you're not, yes.
Exactly.
So everybody is in your
Everybody is in the population, and that is the important thing. And then you overcome the challenge also of comparability. What is also important was, it was also a methodology used in the World Disability Report, where all the data was pulled together from all the countries, creating a single metric.